Let's talk about hormones. The reality is many of you suffer with hormones. In fact, about 80% of women have some sort of what we call hormone dysregulation. And guys, you're no exception. Many of us are experiencing the same thing. In fact, the #1 commercial on TV is something to do with low libido or erectile dysfunction. All that are hormone dysregulation. Now, most people, when they go to their doctor to get their hormones checked, are getting it done inaccurately. Now, the blood tests are okay, and we run some blood tests in here, but unfortunately it doesn't show all the parameters of the hormone system. It only shows A, some of the hormones, and B, it doesn't show you how the hormones are working. We run a very different test in our office. We run a very important test that shows not only all the levels, but also the amount of good versus bad, and the metabolism of the estrogen and other things. This is the very same test that Suzanne Summers recently came out and said saved her life. And I'm going to explain to you a little bit about this test. Now, what you have to understand is there's different types of estrogens in your body. I want you to draw this at home. I want you to put a 2, a 4, and a 16 on a piece of paper. Now, between the 2 and the 4, I want you to draw a line. And I want you to differentiate the two. This is good, and this is bad. As we all know, we have good and bad things going on in our body, and it's the amount of good versus the bad that matters. What your body must do is take bad estrogen, in this case, and convert it to what we call good estrogen. And the body's ability to do that, and the rate at which that conversion occurs, protects you and prevents you from getting some kind of estrogen-dominant cancer. In fact, 1 out of 7 women now are suspected or at risk of getting some kind of cancer. And this is despite all the research, all the drugs, and all the money that we're pouring into that industry. And it's because we're not running the right test and treating it properly. So this is why we run this type of test. On this test, and here's a very quick example of it, and I'm not sure if you can see that or not, but it gives you very nice little graphs here and shows you the ratio differences between the good and the bad. There's 2 phases of what we call estrogen metabolism. Phase 1 is when it takes this 16 and converts it to 2. You want your body to do that. And in fact, the rate at which it does that and the ratio produced as a result of that is what's going to prevent you from getting some kind of cancer. Now, in this phase, it's similar to you taking your garbage out to the curb, okay? Now, the second phase, phase 2, is kind of like the garbage truck coming and taking the garbage away from your house. And this is when it binds to your other bad estrogen 4 and pulls it out of your body. Okay? The way the body does that is it attaches to this number 4 with what they call a methyl group. Methyl groups attach to number 4 and pull it out of the body. Okay? Now, the bad news for most of you is you're methyl deficient, meaning your methyl donors are either deficient or they're being competed by or competed for other things in your body. #1 thing that competes for these methyl donors are toxins. We find so often that toxicity, and in this particular person's example, and I'll show you in a minute, toxins is competing for the methyl donors. The second thing that has a major impact on these methyl donors is stress. When your body produces adrenaline due to stress, these methyl donors also have to bind to it and pull it out of the body. Well, the more toxin you have and the more stress you have, the less amount of these methyl groups are going to be available to bind to this bad estrogen in your body. So the 4 starts to increase, and therefore you're at a higher risk of cancer. So again, recap. Phase 1, phase 2. You want 16 to turn into 2, and you want 4 taken out of your body with the methyl groups. But you have to, more importantly, have the right test ran so you know what to do. If you just looked at your total estrogen levels and you had no idea what these phases were doing, you may mistakenly think that you're fine. In fact, that's what happens most of the time. You go to your doctor, or an individual goes to their doctor, they get a standard blood panel, they're told their levels look within normal range and that they shouldn't worry about it. Yet to find out 1 year later they're diagnosed with cancer. And why is that? Did it develop overnight? And the answer is no. It's just these correct tests wasn't ran so we can look at the actual real numbers versus just a standard number. Now I want to go in a little more detail about this wonderful test and what it measures, but what I need to do is erase the board. So I'm going to stop the video, prepare the board, and I'll be right back. Alright, now let me complete the video and showing you why the test we run is so important and why it's going to save your life. As I mentioned earlier in the last video, or the previous part of the video, that the person, that particular person we were looking at, the charts, that person's methyl donors were being depleted, and that person's methyl donors were being challenged by toxins in their body. And this is a test that we run in our office. This is a heavy metals test. And as you can see, this individual person's lead levels and other levels are way off the charts. So this person was very, very toxic. And as a result, their methyl donors were being depleted and causing that bad ratio to exist. Now, the other thing I want to point out with most standard estrogen tests is they only talk about the one estrogen. You have estradiol, and that's the estrogen that most people know about. But the reality is there's actually 6, but there's 3 that are more important, or most important. You have E1, or estrone, you have E2, estradiol, and you have estratriol, or E3. Now, what you have to understand is these levels are very, very important. E3, although it's the weakest of the 3 estrogens, is actually the most protective of the 3. So you want to make sure you have that. And in fact, E1 turns into E3. E2 is what you call the most dominant estrogen. And this is the one that makes a woman a woman. It gives her the shape, breast development, puberty, and so forth. It is also the most damaging. And when we talk about estrogen-dominant cancers and too much estrogen producing a cancerous state, it's this E2 that we need to be concerned with. Now, versus looking at the overall level of just estrogen, it's very important to know these individual levels. And let me tell you why. We create what we call an estrogen quotient. And we need to understand that this is a very good indicator whether or not you're going to have some kind of estrogen-dominant cancer. What you do and how you calculate this is you take your E3 and you divide it by E1 plus E2. Now, if you're not doing a test that even breaks down these 3, your chance of doing this equation is very little. So that's why, again, it's very important to get the right test. So you take that, and it should be less than 1. Greater than 1. When your E3 is high, it's good, and it makes it greater than 1. If your E3 is depleted, it makes it low and more chance to cancer. The individual that we were talking about earlier, whose methyl donors are being depleted by toxicity, their E3 was very, very low, giving them a quotient of 0.3. As you can see, very, very high risk of cancer. So, again, to sum this up, you need to get the right testing. When you get the right testing, the right diagnosis can be made. And we know exactly what to do with the individual in question here. When the E3 is low and you can't convert it, there's a very specific protocol to do that. We can increase those ratios, those metabolisms, to allow the bad to turn into good. But unless you know these levels, you don't know what to do. So, A, get the right test. That's why we run this particular test in our office. And then B, when you get the right test, make sure you're going down the path of treating it accurately. And it's a very simple fix. This person had heavy metals, so we have to deal with that in addition. But just helping the hormone cycle is something easily done. But again, you can't do it unless you know what's right. Hopefully this helps.